The most common type of these that I see in my practice is something called a meningioma. It's a tumor that comes from the covering of the brain. These are often tumors that people get found by an MRI scan because they had a headache or their face hurt or something like that. The treatment for this can be pretty varied. It doesn't always mean that you have to have a surgery. Sometimes they're found when they're very small. We often just follow them with MRI scans year by year to make sure that they don't grow. There are times where the tumor has either grown or is large enough when it's found that it's causing issues, and we talk about doing either surgery or radiation for the tumor. The main thing that we do for these benign tumors is surgical resection, or something called a craniotomy, which is where I make an incision on the head, make some holes in the skull, and open up the covering to remove the tumor. It is the best treatment for these because typically a gross total resection will cure the patient from this type of tumor. Sometimes we decide that perhaps radiation is a better option. We do give radiation to these either with gamma knife or fractionated radiosurgery. The drawback to radiation is that it doesn't make the tumor disappear, but it should not grow any longer. I don't think every tumor that we find needs to come out. It is something that if a patient is having symptoms or they're having invasion into their brain, then we do often do surgery for those types of tumors.